Good morning, everyone. Today is March 26th for the Finance Planning and Investment Committee meeting. I'd like to call the meeting to order. We do have no citizens wishing to address the committee today. Before we get to the approval of minutes, I would like to add that we do have Charlie and Will out today, so in the leave of absence, Kim will be taking their items today. So we will move to item 3, which is approval of the minutes. The Finance Planning and Investment Committee meeting minutes for February 26th. If I could get a motion.
Second.
Got a first and a second. All in favor? Any opposed? Okay. Item number 4, reports and updates. Jill, if you want to give us the update here, please.
Hi there. Good morning. Just have a quick update on the new parking garage for the master facility plan. As you recall, this was a key part of our master facility plan, ensuring we had enough parking for our patients and guests, as well as our employees. And so the Main Street parking garage opened this past Monday, a week ago, on March the 16th. 8-story parking deck, 2,500 spaces, has a different entrance for staff, a different entrance for our patients and our visitors. And so we opened on March the 16th. Here are some snapshots that our communications department took on that first week. So it was a great day. For those of you who have not been through the garage, I would encourage you to go through it. You will have a really good appreciation for the wider spaces and the ability for our staff to immediately go up to the upper decks. And so they have really quick access to their parking spots as well. The future, this will be adjacent and we'll have a bridge over to our medical outpatient building. And so this is a key part of the campus as we continue to move forward. And then last, our groundbreaking, as a reminder, on Thursday, April the 16th, where our previous surface level parking was before in Lot A there on Main Street, we'll be holding our large groundbreaking ceremony and celebration on April the 16th. At noon. So we, of course, want you all there. We'll have many guests, many community members are excited to come, including our near South Side friends and other partners across the community, as well as our staff and employees. So we look forward to that date. Thank you.
Thank you, Jill. Okay, moving on. Consider matters requiring committee actions. Item A, CFO update to consider and approve the February 26th unaudited financial report, Kim.
All right. Good morning, everyone. As we look at the financial report for February, I don't know why I'm so changed. Looking at the consolidated income statement, it reflects consistency in how we've been performing. Our revenue has been strong. We are seeing improvements in yield, which are related to not only the services we're providing, but revenue cycle improvements, as well as some enhancements to the CHIRP revenue that were not known when we put the budget together. So we have a little bit higher CHIRP revenue coming through. This is also complemented by our management of expenses and the discipline as we've gone through as we continue in this first 5 months of the year. You may look at total operating revenues, which is that first box line. We're about $1.3 million over budget for the year. Volumes have been softer than target for the month on the inpatient side, but it's been offset by outpatient. So when we have inpatient admissions down a little, observation has been up. So we have the same number of patients in the facility. It's just different status for the patients in the facility. So again, still the community is coming. We are providing access and we remain very busy as an organization. When we look at supplemental Medicaid funding, you'll see a favorable variance there. That is our HARP funding. We had budgeted for a $50 million budget. We are coming through at about a $50 million budget. Again, that's for us, it's timing of knowledge of when the final dollars are settled. So that is coming through. As a reminder on that line, last year, remember, we took the impact to DISH in June. So we still have some questions on where we may land in DISH when the final settlement does happen, which will be around May or June again this year. So get excited about the line. It's doing very well, but we don't know what will happen with DISH or UC as we get into the second half of the fiscal year. Operating expenses, you'll see, are also favorable, so about $1.7 million. You'll see up in the wages and benefits, staffing is very favorable, and that is our consistency in working on our workforce optimization work. You'll see our contract labor was a little bit up it was up for the month, but it is more of a year-to-date number. We're looking at how we accrue better from an accounting perspective. We also know that we have some locum tenens usage, which is temporary physician usage in the claim setting, particularly in surgery and internal med. From a benefits perspective, that is running unfavorable. We will see an adjustment to that in March. What that will be is it'll be a reduction of our expense. It'll be also a reduction in our revenue. In pharmacy, we have a recognition of our employee benefit pharmacy claims that we need to adjust. So that variance you should see disappear. So what's happening is there's revenue going to retail pharmacy and the expenses going to the employee benefit. It shouldn't be going where it's going. So what I want to clarify is there's a large variance here that will go away in March. So that's the majority of the benefits variance that we're seeing there. When we get to other operating expenses, the majority of the lines are favorable. Supplies are considerably favorable because the PAP, or the Pharmacy Assistance Program for our patients, is below target for the month, so our expenses are favorable. When we don't have as much benefit going out the door, our supply expense becomes more favorable. Other than that, our supplies are favorable relative to the volumes we're seeing. And purchase services are unfavorable. Those will remain unfavorable for the most of the year as we see we're spreading out the expense for the contaminated soil removal for the MFP project. It was a planned expense. It just belongs to the income statement. And so we did not have that reflected in the budget. So overall, you'll also see investment income was favorable. Again, that is based on the markets and their performance. And so we have come out at about, 4.5 million favorable to budget, about 26 million favorable to budget on a year-to-date basis. So we are really showing, when you look at it graphically, as a reminder, this is a year-to-date graph. So green is last year, blue bar is this year, and the red line is budget. You might wonder, last February, we had some supplementals that hit, so that's why the green is so high last year. So one times that hit. So we continue to see a steady favorable variance to the budget for this year. I will caution you, we do have other initiatives happening the second half of the year. They are planned in the spread. My caution is don't take 5 months, multiply it by 12 and divide by 5. Don't linearly extrapolate it out because we have some other expenses that are going to hit in the latter half of the year. So we are cautiously knowing that we will achieve budget or better by the end of the year. Then we continue to monitor the other budgeted initiatives we have in play. When I mentioned a lot of these on the next page, this is really for you to really reconcile what happened in the performance, both month to date and year to date. It starts with the budget at the top and goes to actual performance at the bottom. So the budget, I'll just look at the month, was 9.2 for the month. Volumes based on it's mostly on the service mix, so less inpatient, more outpatient. Negative rate is a combination of case mix index being down, as well as CHIRP and revenue cycle initiatives, and then the HARP revenue is the 0.9. Wages and benefits are favorable. Those are combined favorable. So as you saw in the income statement, wages are very favorable. And that takes us down to basically the 13.7. There were no one-times that hit this month, no one-time settlements. So that's a pure operating performance that we had for the month. The performance ratios that you're seeing up here show the just the general performance of the organization. The top line is the net margin, which we've talked about being favorable. The labor expense ratio, which is our ratio of our labor expenses and contract labor, not benefits, as a ratio to our net revenue and our pharmacy and grant revenue, anywhere we would use people. And so continues to be favorable. Over time, favorable to budget as well as the prior year. We continue to monitor that, as well as looking at contract labor. Full-time equivalents, I would like to point out, we are down quite a few FTEs compared to the budget as well as prior years. So the workforce optimization work and really putting in those targets in the departments is really beginning to show the results that we had started working on at the beginning of the year. From the balance sheet, you'll see the unrestricted cash, which is the operating cash, days cash on hand are 472. We are at 201 for operating cash. As a reminder, we moved 100 million in January to the future fund. We will be moving more funds in March to the future fund. So that will bring that down to, it'll bring it down to around 180 days pending capital spends that we're looking at for cash. Days in AR, I will comment on, I mentioned as we improve the revenue cycle, they will go up for a little while and then they will come back down. So we're continuing to monitor our improvements there. This is the volume highlights. I'm only going to highlight a couple. I had mentioned that inpatient was down a little, but outpatient was up. Total patient encounters on the top line are up 1.5%, 6% from last year. That's adding inpatient and outpatient encounters together. We're seeing that on the outpatient side. Discharges, again, for the month were below target as well as last year. On the next slide, I'm going to just show you about what observation did. We've now also given you surgery, combining surgery, endo, and IR all together from those procedural spaces. We're slightly, on a total, slightly below budget, not very much, and slightly below last year. But again, you see the shift from in to out. And then lastly, on the emergency room, I'd like to highlight, we actually have the medical emergency room first. We have the PEC second, and then we have a total emergency room visit. These are all the emergency room visits on our campus. We have another small number for OB triage. I think this is important because this is the emergency care that we're providing on our campus. So we will start giving it to you in total. We'll still break out the two big pieces, but we are slightly under, but you'll see again on the outpatient side, we are seeing favorable performance. And then the clinics are performing favorably to target. As I mentioned about in versus observation cases, these are the patients we have in our beds that we're taking care of. You can see on these two graphs the same logistics as the red line is budget. So you'll see the inpatient lines are below budget on inpatient, but on observation, we're over budget. And those are the patients that we're seeing and are occupying our beds in the organization. Our payer mix continues to come down in commercial. We have talked about the ACA. We'll see more about the ACA after the first 90 days of the year and where the patients have decided to opt out of the program or not. They have that first 90 days of the year. We have taken a small reserve into the financials. I'll be fully transparent because we know that some of that will happen. It's not a big reserve, but we looked at the percent of our patients where we might have risk and took a small reserve in February to actually help account for that. And on the ACA, because we know there are going to be patients. And what that means is the patient decides to opt out, no premiums, the payer will come back and recoup the money from us because there will be no coverage. So that happens in the first 90 days. That happens also when they drop coverage during the year, but this 90 days is a bigger window than we normally would have on a routine basis. Lastly is the balance sheet. I've already really talked about the major components, the cash, the board restricted. We are at just under 1.3 billion for the future fund, and then 232 million still remaining to spend in the out of the debt that we've issued. The rate, yeah.
Can I ask a couple questions?
Yeah.
First, what is other on your payer mix? What is that the first?
Other are going to be things like motor vehicle accidents, TRICARE, those types of things. They're so small, they're hard to break out.
Okay. And then I know that the emergency room visits inpatient dropped substantially. Is that due to the split between psychiatric and non-psychiatric, or is there actual drop in volume?
I think it's twofold, and I think you're seeing the move from the main to the behavioral health to PEC. You're seeing that, but you're also seeing patients move from inpatient to observation status. So you're seeing inpatient down, but outpatient up. And so that we're seeing more patients are coming in who don't meet the criteria to be admitted as an inpatient, but we're still seeing them for 1 to 2 days or more as an observation status.
And is that a trend? Is there some reason behind that trend or being discharged during observation?
I would, Jill, is there or Phyllis?
Nothing specific.
Nothing specific?
I mean, we're looking at those cases individually, to understand if there is in our utilization management committee. But there's nothing we've identified, yet.
Okay. And then last.
Overall, I would say overall volume though in the emergency department, whether inpatient or outpatient, is up from prior years. So the volume is still coming in, whether or not they're designated as an inpatient stay versus an outpatient stay is the difference. But the overall volume coming through our emergency department is increased over prior year.
Yes.
Okay, so maybe we had a procedural change or something that is increasing observation.
No, we continue to monitor that. There are backgrounds on billing and how we bill for things, but it really depends on the documentation and the severity of the patient coming in on which status they fit in.
Okay, and my last question, what is the PEC inpatient?
Those are patients who come to the PEC who then get admitted.
Okay,
They arrive at the PEC like you would a main ED, and then they just get admitted as an inpatient.
all right, thank you.
Yes.
And Kim, I've got a couple questions as well. If you could go back to the last slide real quick for us. Well, which one showed the second piece of the bond outstanding, that $325 million?
So on the second box, on the second line, you'll see the 325 million was the outstanding last year of the 450 million that we took out for debt. And now currently we have 232 million still outstanding to spend of the debt.
So the $325 million issue, when do you anticipate that coming down the line? Is it in the next 12 months?
Okay, so you're talking about the tranche two, this
Tranche two,
350?
yes.
Yes, we actually, right now, we're waiting, the rating agencies will rate us. We're getting on a new cycle. So next spring, at about this time, we would be able to go out for debt in about a year.
Okay, I got you. So 27.
Yeah.
And once we obtain those monies, what do you anticipate the impact to be on our cash flow?
So those monies will be designated for the future fund specifically.
Right.
And they are not part of our days cash on hand.
But as far as the cost of capital, what does that look like?
So the cost of capital for the debt is usually around 4%. And
Gotcha.
so it's pretty close to what we're getting on investment returns.
Right.
And so we will continue investing based on the quarterly cash flows that we're doing and the expectation of the spend on the master facility plan.
But once that money is issued, we're obligated to make payments on it. That's
Yes, correct.
right. Okay.
Correct.
And the payments you're saying should be offset by the investment income or very close to it?
Well, we can create investment income off the debt that doesn't exceed the interest we're paying.
Right.
Once
I see.
we exceed it, we have to pay the IRS back.
Okay. Gotcha.
Yeah.
Okay. Thank you.
Yes. Good questions. Get to the next slide. So balance sheet key ratios, we did chat. I just think these are good visuals for you to have. The total days cash on hand at 472, the dotted black line below is 201. Well, it's not marked, it is 201, and you'll see the green line, which is Moody's benchmark for the AA rating. And net days in AR have gone up. We know that, we're monitoring that, but we are actually holding on to claims longer right now in order to work some more denial categories. The cash flow that we've seen since the beginning of the year, we start with cash receipts for the year. This is everything that's happened during the year. And the net change you'll see at $59 million, just under 60 million. We started the beginning of the year with 877 million. We added 60 million to it, so it's the 937 that ties to the cash on the balance sheet. So we've generated another 60 million of cash. We will use that 60 million for debt. We use it for capital. We use for any expenses that we need to fund really off balance sheet, because this is the cash we use to fund those activities. And then the last slide has the financial goals. Last month we had 4 of the 12. We're on a red status. We are now at 3 of the 12, doing well. And we've talked about these, length of stay we continue to monitor. We have more initiatives underway. And the connections, which is the last one, that's a year-to-date target, and we're getting very close to the year target. So that'll turn green as we progress during the year. So I think our performance still remains positive as we are carefully tracking the ACA right now, because that could have an impact. The Medicaid supplementals can have an impact. And there's also the unknown of what the federal or the state governments could do. So we have that, but we are focusing on continuously improving and taking care of those patients we're seeing. Any questions from the group? DT?
Let's see if that counts.
So DT, the days in ARs is going up specifically because we're not writing off claims as fast as we were writing off denials. So we are actually working denials longer and more deeply than we were. So that's pushing the days up right now.
I'm seeing that we generate money, but converting them to cash. So how we own financial strength becomes one. Life. The conservatorship the UK collection slow is quite a strong one. Right, stay late. That's the thing that we got. And then the other way from us. Obviously, the length of stay increased, so the food has to constrain that. The length of stay 5.9 was 5.7. That's 5 points. But 3.7% increase was needed. So we look at the direct impact on that availability. Hospital case, that the system is not holding the patient. It is holding the patient longer, which is capacity and increase at the same time. That is a little bit concerned for me. And the third one being the patient longer, it makes it with the acute discharge down. The patient certainly down. It makes my best down. But our patient is slightly down. I don't see that we shift away from the acute. I am not in care, but the same the water damage. And that mistake could be documentation and form again. Will not have to say that. And then psychiatric man grow see psyche visit in the that outpatient of time from that. Really do well. Slowly work on that. It's a strain of EV patient capacity. With the bench, they increase the good quality. So we are financially strong, but the quality of the can slow down. Patient stays on the patient and be able to.
So I think those are all good points, DT, and I think they're all areas that we're working on, particularly with the expenses related to delivering care. Revenue cycle is improving, and I think the AR days, as I mentioned, I think we're watching that very closely. We're also watching payer payment activity, and if they are delaying payment, I think the length of stay, we have a very good opportunity that we are working on every single week about how they work every day on throughput. How do we get patients out? Because we know we have capacity constraints. And so I think you brought up all good points that we monitor on almost a daily basis.
The signal.
Yes, absolutely. Thank you.
Do have this conversation, I think, in space, you got that space, and we also have this. Sometimes having the bottom line. Like, if everything is going well, but where.
Any more questions about the financials?
No further questions? Okay, Kim, we appreciate that presentation. So with that, we'll take a motion to approve the February 2026 unaudited financial report. Got a first? Got a second? All in favor? Any opposed? So motion carries. And we've got item B is to consider approval of the professional service agreement between Tarrant County Hospital District and GBBS Healthcare Solutions, Inc. Kim.
Yes. So this is consideration for the GABS Healthcare Solutions contract. It is a 5-year agreement. It's 3 years with 2 optional 1-year renewals at a total cost of $1.162 million roughly. It was awarded through an RFP that had 11 respondents, and this vendor provides us coding auditing services that are behind our coders that just basically make sure that we are consistent and being compliant. We do have KPIs associated with this contract and this vendor, and we're asking for the board to approve this new agreement with GABS.
Kim, is this a new service or is this an extension or
This-
replacement?
This is an incumbent vendor. We've used them for the past 5 years, and so we did an RFP and then reselected them as the next 5 years. Okay. You want to just keep going?
Yeah.
Oh, approval by contract, sorry.
Okay, I've got a first.
Do them all at
If I
once.
could get a second. Got a second here. All in favor? Aye. Any opposed? Motion carries. Okay. Item C is to consider consider approval of the Fourth Amendment to Professional Service Agreement between Tarrant County Hospital District and FinThrive Healthcare. Thank you, Kim.
So FinThrive Healthcare provides 2 services for us. One's claims management. This is for the professional services that they provide for us. And it is a proprietary software that we use to identify coverage for patients, whether it be Medicare, Medicaid, or potential other third-party coverage. This contract expires in May of this year. As part of the contract, there's an option for a 120-day extension at the end of the contract to go through an RFP. So we are asking for that 4-month extension at $280,000 so that we can go through an RFP to evaluate the vendor to move, whatever vendor to move forward with the same service.
Got a first? Got a second? All in favor? Any opposed? Okay, we've got DT recusing himself. Okay, but the motion carries. So, all right, we have got item D is to consider approval of pricing between Tarrant County Hospital District and Medtronic USA. Kim.
Yes, Medtronic is a supply vendor for us that supplies basically cardiac rhythm management, which is pacemakers, defibrillators, insertable cardiac monitors for our patients. We are asking for a 2-year agreement. It's about a $4 million cost. Again, it's a variable cost on volume. So it's a $4 million total cost for 2 years. We had 2 vendors respond to the RFP. The other vendor who responded is also a secondary vendor for us. And so we're asking for approval to move forward with this agreement.
With no further questions, if I could get a motion. Okay, I've got first and a second. All in favor? Any opposed? Okay, item E, Kim again, consider approval of Betcon Dickinson contract between Tarrant County Hospital District and Betcon Dickinson and Company. Kim.
Sure. This is a supply agreement for 5 years. It is through our GPO Vizient. It is for a total cost of $7 million for the IV tubing that goes with our Alaris pumps. So it is a specific vendor required to order this IV tubing. Asking for approval.
No questions, if I could get a motion. Got a first, a second, all in favor? Okay, any opposed? Motion carries. On to item F. This is going to be Kim again, to consider approval of the purchase agreement between Tarrant County Hospital District and Stryker Cells.
Yes, this is approval to purchase 400 med-surg mattresses from Stryker. The cost is $1,486,628. It is for 1 year. It is a one-time purchase process, so that's why it's a 1 year agreement. It was awarded through the GPO Vizient for our contract.
What is the life of those mattresses? What's the life?
Mattresses, first of all, it depends on how many times you put somebody on a mattress, as you know, at home, but you would say about 5 years.
Okay. Thank you. Okay, if I could get a motion. All right, we've got a first, got a second, all in favor? Any opposed? Okay, the motion carries. Kim, we've got item G again here. So consider approval of 1, exemption to bid, and 2, master purchase agreement between Tarrant County Hospital and Kia Gen.
This is both a dual request exemption to bid, primarily because these are supplies, reagents that go with the lab analyzers that we have. So it's a sole source. We cannot purchase these from anyone else. This is also going to allow to move our quantiferin testing, our TB testing in-house. So we're requesting approval for these reagents at a cost of $1,160,045.
No further questions, if I could get a motion? All right, I've got a first and a second, all in favor? Any opposed? Okay, the motion carries there. Item H is to consider approval of the second amendment to reference laboratory services agreement between Tarrant County Hospital District and ARUP Laboratories. Kim.
Yes, ARUP Laboratories is a reference lab that we send complex and difficult lab testing out to. It is a 5-year agreement awarded through our GPO, and we are requesting the 5-year cost of $28,818,280.
Entertain a motion. First, second, all in favor? Any opposed? Okay, motion carries. Thank you, Kim. We've got item I, Dr. Alawi, I'm sorry. Yes.
Is it possible that we could know how many vendors did on this item? Is there a way to be?
Yes, I get,
Yeah, we usually include it on the executive summary.
Yeah.
And many were GPO awarded this time, so.
gotcha.
Yeah, we'll make sure.
Thank you, Reverend. Okay, I've got item I here is to consider approval of request for increase to services PO between Tarrant County Hospital District and Texas Treatment Centers. Dr. Alawi.
Yes, thank you. So Texas Treatment Centers is the group that provides our medication-assisted treatment for opioid use disorder at the Tarrant County Jail for methadone. We're requesting an approval to increase that spend by $486,763. By Texas Jail Commission standard, we're required to provide methadone, Suboxone, and Subutex to these patients. And when we originally signed the contract, we were uncertain of the volume, as this had not been a service we provided previously. And we've got an increasing population growth, both in the jail as well as those needing medication-assisted treatment. Yes, ma'am. Yes, yes, ma'am. So this is covered by our opioid abatement dollars.
Okay, thank you. I've got a first. Got a second, and all in favor? Any opposed? Okay, thank you, Dr. Alawi.
Thank you.
Okay, I've got Dr. Elliott here. Is item J is to consider approval of the GMA formula funding agreement between Tarrant County Hospital District and the University of North Texas Health Science. Thank you.
Thank you. Good morning. We are seeking approval for our GME formula funding agreement as stated. That is in collaboration with the University of North Texas Health Science Center. This supports our ACGME accredited residency program through the state GME formula funding. This is for $4,077,510 over a 3-year period, which is also part of our FY26 budget.
Any questions? I'd like to entertain a motion. Got a first. Got a second. All in favor? Any opposed?
Increase in,
Yep.
and pressure. It used to be, we didn't get it. Good job.
Thank you, Dr.
Thank you. Okay, Brian, item K. We've got item K here is to consider approval of 1, the exemption to bid, and 2, Encore facility extension agreement between Tarrant County Hospital District and Encore Electric Delivery Company.
Good morning. Yes, thank you. Requesting approval of the $6,761,780.70 contract with Encore to provide electrical service to or for all of the master facility program projects.
Brian, I have a question on this.
Certainly.
When you're dealing with a monopoly, is there any price negotiation or they just say, here it is?
Yes, there's a lot of discussions and we have benchmark data, but you are a little bit at their mercy. That helps. We started at about $32 million. So
It came down from 32 to 6.7.
they originally priced going all underground from every substation to our campus.
So but they changed the scope of the work.
Yes, yes.
You didn't talk them down $26 million.
No. We changed the expectation.
And that is a fixed cost or then any variability on this?
No, this is just for the service. The cost of electricity is a monthly outside of this would be an operational expense.
Mhm.
Yes,
Mhm.
yes.
Okay, I'd like to entertain a motion. I've got a first.
We don't have to own this. It took me a long time to read on.
Okay, I've got a second. All in favor? Any opposed? Okay, the motion carried. You have electricity.
Thank you.
Good morning.
Okay, good morning. We've got item L here is to consider approval of the First Amendment to the program amendment between Tarrant County Hospital District and Incentive Services, Inc. Kelly.
Yes, good morning. So I'm requesting your approval to amend our contract with Incentive Services for 2 years at a cost of $1.4,370,000. Incentive Services is our current online reward and recognition platform. And we use that platform. It's integrated with the district's information technology system to recognize and reward team members for outstanding performance. Any questions?
I have a question.
Sure.
Is this cost for the software only, or is this for the awards that are given to the employees also?
So this is a cost for the software. They set everything up for us. They work with us as we add things to the platform. So it's for the software.
Okay, with no further questions, I'd like to entertain a motion. Okay, first, a second, all in favor? Any opposed? Okay, the motion carries. Thank you, Kelly. All right, I've got item M as well for Kelly. So to consider approval of statement of work between Tarrant County Hospital District and Gallup Inc.
Yes, this is an approval for a 1-year extension to our current contract with Gallup at a cost of $211,500. JPS currently utilizes Gallup to administer and support our annual and employee clinician and engagement surveys, in addition to our pulse survey.
Entertain a motion. I've got-
Exemption and the statement of work between the Tarrant County Hospital District and Gallup.
All right, thank you. A second. All in favor? Any opposed? Okay, thank you so much, Kelly.
Thank you.
All right, and so Kim is taking the place of Will in his absence for the remaining items here. Thank you, Kim.
Okay. All right, have, proposal for exemption to bid as well as a second amendment to the ChartMax software licensing license. The ChartMax software, it says Quest Diagnostic Labs on here. It's a little deceiving. ChartMax is owned by Quest, but ChartMax is our clinical documentation management system that sits outside of Epic. We are asking for exemption to bid because we need the system for one more year in order to get Epic Gallery up and running, and it will replace this software. So it'd be too laborious to actually go out for RFP for 1 year to replace this document management system. So that is why the exemption to bid is being requested. So we are requesting this second amendment for 1 year. We are launching Gallery, starting it in August, and the cost is $252,656.
Question for Daphne. The exemptions to bid, is it a legitimate exemption that it'd be too laborious to get bids? Is that one of the permitted exemptions?
Well, not just too laborious, we consider the facts and circumstances, whether it's been practical to get bids. So that is one of the considerations.
Okay.
All right, if I could entertain a motion. Got a first? Okay, we got a first to include the exemption of bid. I've got a second. All in favor? Any opposed? Okay, thank you, Kim. We're on to item O.
Excellent. This is an addendum to a DIR contract between Tarrant County Hospital District and Clear Technologies. This is a cybersecurity platform that we have. We're asking for a 1-year renewal of $212,618.06 for this platform. This platform is very important into our security incident and management platform. It actually, just so you're aware, it pulls in all the log information from the laptops and everything. So that's what it brings in. And then it brings it to our Cisco platform, which is our main security platform. So I'm asking for approval.
If I could get a motion. I've got a first. Got a second. All in favor? Any opposed? Okay, motion carries. We're on to item P. It's also Kim.
Yes, this is an increase for the Risk Connect subscription order. An RFP was done for this. There was only one respondent, which was Risk Connect. We had contracted for certain modules for this at originally just under 1.2 million, which the board had approved, but we needed also to include the compliance module. So we're requesting another module for this contract at $287,394. Yes, it was all part of the RFP. It just wasn't contracted at the time.
Got a first? A second, all in favor? Any opposed? Okay, the motion carries. On to item Q, that's also Kim as well.
All right, the next two contracts are related. Innova Solutions, this is the Microsoft renewal for our Microsoft licenses for Office 365, our email, our Teams, and all of the business applications that we get from Microsoft. This is a DIR award. It is for 3 years at a cost of $11,604,136.75. And this will be in combination with the next contract review. Together, they will save us about $2.2 million a year.
Okay, so we're entertaining a motion just on the one item, is that correct?
Correct.
Okay, if I could get a motion. I've got the first, if I could get a second.
Second.
All in favor? Any opposed? Okay, the motion carries on to item R, our final item here today.
Yes, this is the contract between the hospital district and Crayon Software Experts. This is the other half of the Microsoft licensing for 3 years at $3,422,206.65. It's a DIR contract. This is for the server and cloud environment, so our servers and all in Azure, the cloud, and all those environments that are not the business operations. And so this is awarded through DIR, and we're asking your approval.
I can entertain a motion. I've got a first. I've got a second. All in favor? Any opposed? Okay, the motion carries. Thank you, Kim. All right, I believe that conducts today's business items. I would like to say, don't forget that we've got the grand or the ribbon cutting ceremony in April for the main hospital. So I believe I've got a calendar invite. I believe everyone should have a big one. So it's a big one coming down the pike and excited for that. Thank you, Jill, for all the updates. And in May is also our budget retreat. So I guess be mindful of that's coming pretty quickly as well, and to communicate with commissioners and a lot of moving pieces here. So look forward to that. If there's no other items of business, I believe we will adjourn today's meeting. So meeting is adjourned at 10:51. Thank you.